in so many different venues where I've felt that I have collaborated with others to help people. And one particular instance would be in home care, keeping people at home. It's a challenge anytime to keep someone who wants to be home. And through that experience, I learned that people have the right to self-determine. And I think if you ever work in home care, you realize that. And then in my background with workers' comp, it's really exciting to see the nurses in the field making a difference, going to the providers, giving them the job description, helping our patients or claimants, as we call them, get back to work and get back to work safely. I've had feedback that, the case manager really took the time, educated me, listened to me, and helped me get back to work, and I really want to thank you.
We got him in the early window of 0 to 1 years old, and he was from Guatemala, and I spoke Spanish, and I worked with a multidisciplinary team, and together with the social worker, the physician, all the specialists, we made that child, by the age of 3, when I closed the case, we were able to make an impact and give him a true quality of life.
I had a veteran who had suffered a significant traumatic brain injury, and that's the field that I work in at the medical center. And I worked with the family. They were out of state. They wanted to relocate him back home. And we worked with the systems within the VA and coordinated a very comprehensive care for him and had him transferred into a facility that would address his needs as a traumatic brain injured individual.
I had this one member I was managing who was an oncology member, and he had multiple pain issues, and he saw different providers for his pain issues. So I needed to get an idea of what the other physicians' treatment plans were before I called his primary oncologist. And I told the oncologist, I said this was an issue, he needed a quarterback, and if he would be willing to work with us to coordinate his care for his pain issues. So the feedback I got, the member called me very excited. Oh, the doctor said he was going to quarterback his pain issues, and he sent him to a pain specialist.
I had a gentleman that needed some extra care. He didn't speak English, he needed transportation, he had no family members, so I had to set up an inpatient stay overnight, transportation home care, and transportation to ongoing doctor's appointments and therapy appointments.
I was part of a small team that we took products that McKesson had already developed and implemented them, brought them into the community. We hired case managers locally. We got them into a practice setting, working with a medical group that was employed by the hospital. And then we started to procure people who were high on the list of overutilizers, high cost, that had chronic conditions. I mean, there were things that we did to kind of select the best possible individuals. And we got them hooked up with a case manager, with a primary care physician. We got them all their medications. We got them healthcare education. We started educating them, working with them. Their case managers were calling them regular. We gave them condition education as far as whatever, if it was diabetes or asthma, CHF, the big chronic conditions. And got them away from the emergency department or waiting until they got so horribly sick that they ended up getting admitted. That project, that's kind of a brief description of the project. It was extremely rewarding because we made an impact in that community.
Basically, I'm just a patient advocate for people that get injured at work.
I had a case recently where the patient was facing a poor prognosis, and I was instrumental in assisting the primary care physician with making sure that the patient had as much information as we could provide so that they could make a fully informed decision. And the patient ultimately made the decision that was best for him. It wasn't a decision that included all treatment that could be provided, but one that was really focused on comfort. And I really felt good about, really empowering the patient with the information that they needed. I really felt good about that.
I think as a case manager every day you make a difference in the lives of the clients you work with.
But one particular veteran was referred to my program in community residential care who was in jeopardy of being evicted from his home related to mold issues and inadequate plumbing. And he had a serious mental illness and had trust issues. So it was really hard for him to think about leaving his environment. But we were able to work with him and his community providers and develop a plan as a partner with him to make sure that he was comfortable with the next steps. And it took a long time, over 6 months, for him to take the next step to permanent housing. And in doing that, it really changed the quality of his life, where his nutrition status changed, his medical needs improved, and his overall mental well-being really, his overall quality of life was really different. And he could report that. He could make reference to how his life had improved with the changes of having a different housing situation.
I can talk about a situation in regards to an elder recluse who passed away at a hospital, and in order to provide him with a dignified burial, I had to negotiate the community, try to identify a caregiver, work with funeral homes to help identify that he was a veteran, get the Veterans Affairs involved, and just ensure that he had some dignified passing.
For me personally, I always think about this one young man that I worked with as a case manager. He was someone who had a head injury. This is when I worked in an acute rehab facility, and he had some behaviors that were really problematic as a result of his head injury, and his family was real nervous and reluctant to take him home. And I was able to work with his family and gather resources together for him and work with the rehab team to help him improve, but to also help the family to learn and to be resourced for how they were going to manage his behavior at home. And it worked out. And he went home and he's doing real well.
The one that comes to mind is an injured worker who was injured in Maine, way up in Maine, almost to the Canadian border, who was 65 years old. He was in a machine that went over, and he became a quadriplegic. And the company I work for actually sent him to a center of excellence, and he spent a year there with his family. And with that, there was not a lot of healthcare providers in his area, so they actually bought him land, built him a house down in Bangor, and moved the entire family so that he had a place, and built an ADA home, a beautiful home. Mm-hmm. And I got to meet this gentleman afterwards with my nurse that I had worked with on this, and to see how appreciative he was for what nurses did and how we helped him to get what he needed. Because here's a gentleman who went to work one day and he came home as a quadriplegic. And the fact that we were willing to do that, he actually wrote a letter to the CEO for the company I work for, thanking for everything, and to see him. And he was a gentleman who told me he had to decide whether he was going to live or die. He knew that moment, he decided he was going to live, and he did phenomenal. But it was because of all the care he was given. We were able to find a contractor who could build that home for him. That was very rewarding because that changed his life forever. He was close to retirement.
There's been, over my 30 years in case management, there's been a lot of cases. I think the most recent one was winning over an elderly woman who was not doing well health-wise. But I took the time to listen to her and to pull out from her what she really had as an agenda. I served the need she had by getting services out to her home, but also respecting her autonomy. So we both felt a win-win there.
In one case that I had recently was a pediatric case where I worked with the mom and the patient to set up TPN for home. This is a patient that had a malnutrition disorder who was treated in town, but we tried to set up a comparable regional hospital system for this patient so that they could be treated locally and not have to keep leaving the Cape area. So they came into our pediatric center, and what we were able to do is set up TPN and actually work with the drug company to have them sponsor research TPN we were using for this patient. and we were able to get it in and work with a Boston-based hospital to give her the formula she needed that would help, and had lipids. It was a lipid-based formula, and we were able to get that set up for her right at home, so she didn't have to leave home. She didn't have to go to Boston and be an hour and a half away from her mom, but she could stay at home. Her mom could provide the care, and we were able to get local people to come in and be with her every day so she could be with her family.
A member that sticks out in my mind was a commercial member. He was in New York visiting his family, and he ended up getting a laceration on his arm, went to the ER and got a really major infection, and they had put him on IV antibiotics. So because he was out of state and out of the service area, I had to coordinate the care with the provider in New York, have discussions with our medical director to make sure that we were, going to cover it, and then trying to access care once he got returned to the service area. He had only signed up with us not too long before he had gotten injured, and really didn't have a relationship with his PCP, so we needed somebody to coordinate care, and so I was able to facilitate him receiving the IV antibiotics for the 7 days, for initial 7 days, I should say, until he was well enough to travel, because he was driving back into Massachusetts, back home, and then facilitated getting him set up with a PCP who would see him as soon as he hit the state, and evaluate him and see for any further treatment what he needed.